Okay, well, thank you for joining us, everyone. We have this is our first ever Eviva podcast, so I'm very thankful for we have a couple of patients that are joining us, Kathy and Lindsay. Thank you for joining us. I'm Dr. Brandon VanderWel. I'm one of the bariatric surgeons at Eviva. We have been doing weight loss surgery for a long time. We've been doing ESGs, endoscopic sleeve gastroplasty. That's what we're going to talk about today. We've been doing this for over 3 years at the moment, where we are currently. I've done hundreds and hundreds of patients, and yeah, there's a lot of interest out there, and we're just trying to share what the ESG is a little bit, and then just what it's like on this journey from, how people get here, and then what it's like afterwards. So without further ado, I'll jump into I got prepared a quick ESG. What is it? So Dr. VanderWel, we have Lindsay, we have Kathy, and Emily might be joining us too a little bit later. Endoscopic sleeve gastroplasty, the ESG. So that is an endoscopic bariatric procedure. I'm going to switch, let's see here, share windows. It's really fancy, guys, super fancy. Here we go. So this is an endoscopic procedure that closes the stomach from the inside. You take small bites of the stomach from the inside, and it reduces the stomach size and makes it a lot smaller. So it's done with this overstitch device. That's this thing right here. And this is able to allow us to do stitching, like full thickness stitches from inside the stomach. So there's not incisions, nothing's removed. You can see here, like it goes down and it takes bites of the stomach. We get a full thickness bite, and then we take multiples of these and then close it down over time. Over a lot of sutures, I put a lot of stitches in this thing, usually somewhere between 8 to 11 sutures for most patients. And it really reduces the size of the stomach from this big bag down to a small tube. And we'll talk about that hormonally, the stomach, those cell layers on the outside, when you reduce that surface area, it hormonally improves the goal of the surgery. And then it also just makes it smaller. So This is kind of talking about some of the data that's from their randomized control trial, which is super cool. And switch it over back to my slides. Yeah, so our experience with the ESG, this is our first, almost 200 patients. Our total body weight loss at 1 year was 23% excess. So that means from where they started down to their 1 year mark was a total loss of 23%. Excess weight was 73%, and excess weight means whatever BMI they started at. A considered normal BMI is 25, and BMI is a whole thing. It's not perfect by any means, but it's a way we have to measure. It's just a metric. BMI 25 is considered the high end of normal. And so excess weight loss is calculated as between where you are now, where you start from, and how close you get to excess weight, to BMI of 25. So if you get to BMI of 25, you've lost 100% of your excess weight. These patients, our average weight loss is 73% total body weight loss. So the adverse events were low, 2%, and we had great remission and really good improvements of hypertension and diabetes, which is always the goal. So how do you best use the ESG? It's a tool, it's not a cure. We tell people it's a procedure, it's the program working together for long-term success, because the tool is just a tool. You need the skills to get the most out of the tool and to maintain the tool long-term. If you don't have those skills, we see this with any weight loss surgery. This is not unique to the ESG. If people aren't taking care of the tool, if they're not using it well, they're just not going to get the most out of it, and they're not going to be able to maintain that success. We have a whole program that afterwards you get pretty sick of us. There's a lot of visits in there. You meet with the dietitian, you meet with myself, you meet with our PA, potentially medical weight loss, if that's helpful for you as well. All these things are tools, but our goal in the program, we have very specific portion sizes, and that's really important. I think the portion size piece is a very important part of this journey, because your stomach is very small, and we'll talk about this in a little bit too, but you don't want to depend on stretching it to be your stop sign for eating. I tell people, I want your stop sign for eating to be a size, not a feeling. So we give you clear guidelines during the follow-up portion of after the procedure to help you with just staying within that. And I tell people the goal is not that we're like, oh man, I'm right there. Yeah, perfect. Oh yeah. That's not necessarily the goal. Sometimes that does happen. That's great, whatever. But really the goal is like you have your portion size, you're like, okay, all right, moving on with my life. Um, and we have calorie guidelines, we have protein guidelines, we have carbohydrate guidelines, and then replacement guidelines for exercise. This is an example of what we do. This is kind of our starting framework. Every patient is unique. Everyone's story is a little bit different. Everyone's body is a little different. So this is why we tailor that program to what's going to be best for you. So it's a great starting point, but that's why that follow-up plan is so important so that we figure out what's going to be the best for you. What is it like? Expectations that we tell people after surgery, hunger-wise, it's reduced, but it's not completely eliminated. That's true of almost any bariatric surgery. There's none of them are like where your hunger is completely gone. And then restriction. This is always, I always don't love the word restriction because I think it's taking maybe a little too far. That's its own topic, but it's a helpful guardrail. And just like with a guardrail, you don't want to turn your car by using a guardrail. It's there for when things are, maybe get a little bit shaky. Because if you use the guardrail to turn your car, over time it will break down and it's not going to work as well as it used to. So we don't want weight loss surgery to be like bumper bowling, right? Where you're like, bouncing the thing off the rails. Our goal is really to keep you on the straight and narrow, but you have that safety net sort of back in there. So, but this is our goal. We want to really help you do this. And I think this is a great way to emphasize as well that what these procedures do. People ask me all the time, well, couldn't I just do this follow-up thing, this diet, and not have the ESG or any other procedure? And I say, yeah, absolutely. You can go ahead, go for it. Most of the time, that is just an insurmountable task for most people. Your body really, really fights this. And what's really interesting after these procedures, it just seems to flip some switches in there where all of a sudden you're just totally this is so much more doable now. And you're like, oh, okay, I guess I can do this now. And you're like, yeah, I guess, okay, I got some new guidelines, I got some new routines, but this is a very much more manageable situation now. And you're able to actually, with some structure and with some training and practice, you're able to really largely stick to these guidelines. So all right, enough talking from me. I'd love to hear about, I think, and what our patients really want to hear too is, what is it like? So see here, did I stop sharing my screen? Is that
Yes.
It's just all of us now? Perfect. So Lindsay, if you want to start, I know you're kind of the, I wanted to get someone that had just recently sort of gone through the procedure because a lot of people sort of forget what it's like initially right afterwards.
I'm already forgetting. So
Yeah.
I'm
So tell me, like,
okay.
how far out are you and what it's been like, just kind of what it's been like so far.
Yeah, so I'm just over 2 weeks post-op. And I already like have blocked out the clear liquid stage.
Yeah.
um
There's some programs that like put people on liquids for a very long time. That is
yeah,
not our program. Uh,
no.
we do like 7 to 10 days of liquids,
Yeah.
and and most of the time, at 10 days is technically a thing. And if I see you at 7 days and you're doing good, I'm like, okay, let's get on to purees. This is just cruel and unusual.
Yeah.
Yeah.
Yeah, so the clear liquids were probably the hardest, but I think one of the biggest things for me was um feeling really prepared up until the surgery. So like really focusing on getting good protein, um, and following the plan that you had out of like working out 3 times and kind of pushing yourself. I felt like that carried me through those couple of days that were pretty hard. And then I kind of like got tired a little bit right after that when I moved on to full liquids as my body was processing more. But I mean, I was doing pretty good right away. I went back to work. I had my procedure on a Thursday. I went back to work the next Tuesday. I mean, I worked from home, so that was helpful. But didn't even tell anyone what was going on and just worked for the rest of the week. And I'm on purees now, which I'm really excited to not be on purees. It's not my vibe, texture wise, but I had an egg this morning, so that was good.
Yeah. Yeah.
And when you said the thing out of like, you could just try this on your own. There is no way in the world I would have been able to eat what I'm eating, like what I ate yesterday or the day before, and not have been going out of my mind. But I just ate it and I was like, okay, great. And I'm like, oh man, I got to eat again in a couple hours. Like, oh, okay, I guess I will. But it was not, I would never have been able to do that.
Yeah.
And it's not a problem. And I'm getting into a groove of when I take my vitamins and when I eat my food. And like, I try to have a certain amount of water down by noon. And, I think I'm just following what I need to do and getting really comfortable in what that rhythm looks like.
Yeah. No, it's cool. It's so interesting. I love it as a bariatric surgeon. I think these surgeries are fascinating, just fascinating what they do and how they really improve all those, like all the metrics. And especially we're seeing them now with a lot of like the new GLP-1 drugs like Ozempic and Wegovy and Mounjaro. Like what those drugs do is what bariatric surgery does. And bariatric surgery has effects of more of the there's several more hormones that are affected.
Mm-hmm.
And it's just that's what I've always loved bariatric surgery. I mean, there's so many things about it, but it's so interesting. It's like physiologic surgery. Like we're doing surgery on the stomach as a hormonal organ. Yeah, it's wild.
Yeah.
Cool. Well, thank you for sharing that stuff. Kathy, how about tell us like how far out are you and what it's been like so far?
So I'm a little over 10 months out, and so far it's been fantastic. So I couldn't agree with Lindsay more that to think of well, first of all, the assertion that, well, couldn't I just do this on my own, or why don't you just do this on your own? It's like, well, if I could have done this on my own, I would have done this on my own. Like to think that we haven't tried to do, okay, I've never tried to eat a quarter cup portions on my own all day long, but
good luck. Yeah.
Yeah. Well,
good
and also,
luck.
Correct me, Dr. VanderWel, but like that would also be like, there's a reason that the aftercare is pretty intense because you have to be on supplements. You have to be monitored pretty closely because it is a very small amount of food. But that's one of the things, like, that's why you want to do, like, you want to have really, really, really good aftercare. It's something that anytime I ever speak to someone who is considering, frankly, any bariatric surgery,
for sure.
but I think particularly ESG, make sure that you have a really, really good aftercare program a year. Like, look for a year because you really do need to be cared for. You need to be monitored. There's a reason that you should be monitored. But my experience has been fantastic. I think that the biggest gift that I was given, honestly, from having ESG was actually that first like 2 months. And it wasn't necessarily about the restriction. It was right to your point, Dr. VanderWel. It was the removal of that hormone for a while. It was the lowering of the hunger hormones. It allowed me to really address behaviors that had sabotaged me in the past. And I was able to identify some things that were actually really serious in the way that I behaved and interacted with food, and was able to work with my therapist on it. And I think that that's really critical, that aspect of it for me was instrumental in my success. And I was able to relearn my behaviors without being driven by impulses to eat, by hunger, by just compulsion to eat. There were a lot of things that were taken off the table for a while, gave me the freedom to actually relearn my behaviors successfully.
Absolutely.
And then implement them as I go forward. And yes, the hunger hormones, they do come back. But now it's not the same. I'm not as compelled to just right away eat, like just things like that, or eat until I'm super full.
Yeah.
That's been my experience. I honestly couldn't recommend it more.
Yeah, no, I think you hit on so many good points there that it's a tool that you really need to follow closely. And I tell people the ESG is particularly a tool that, like you said, that you really want to use in a very specific way, because it's not quite like the other bariatric surgeries. I would say the hunger, after any bariatric surgery, hunger does come back over time. Like those hormones in your body hunger is a primal instinct, a primal necessary
Yeah.
instinct, or else human
I
race
want
would
to
not.
be hungry.
Yes,
I'm
you
a
do.
human
And
being.
honestly, you do. I have a few times a year, I'll run into a patient who is years out from a surgery and they still have no hunger. And it's honestly kind of tough for them because they're like, my life sucks. Like I have to like force myself to eat. I don't really enjoy food. Like that's, it's not very, they're not like it's my life sucks. It's like my relationship with food is like, I just wish I had actually a little bit more hunger so that I enjoyed a little bit of food and I wasn't force feeding myself. But it's not very common. Most times people's hunger does come back because your body will accommodate some level of change there because, and also as you lose weight, your body sends more signals of like, hey, we gotta like, we gotta hit some sort of threshold. I have this theory, like I call it the weight thermostat theory, that everyone's body has their weight range is set somewhere in their body. We don't really know why or how, but it's really weird. You may can say this, what's you kind of experiencing yourself, that thermostat just gets sort of reset. And there's some switches that get flipped in there. And all of a sudden it's like, oh yeah, we're down here now. Because before, right, when you would lose a little bit of weight, your body would be like, oh my gosh, red alert. Why are you doing this? We're going to die. We're not going to survive the winter. And now it's like, let's go. We got some energy in the tank, keep going. Road trip, So it's fascinating. And I think also to that point of like all the other parts of this journey that are not the scale, that are not how your clothes feel, I think that's why I love bariatric surgery as well, is that, I mean, that's honestly one of the greatest joys to me, seeing people at a year. It's not what the number says on the scale. It's how your life is and how your perspective on life is so different now. And it's one of the greatest things I think about being a bariatric surgeon is seeing that you really are improving people's lives, not just like solving a problem. Yeah.
Yeah.
So it's not, and at that point it's not even us, like it's not even the surgeon or it's even our team. It's like it's you being in the driver's seat of your life again. It's like the coolest thing, So it's a great journey. It's like I tell people, I mean, you can tell me what you think of this. Like I tell people all the time, this journey is not complicated, but it's not easy.
Yeah, I would completely agree with that. It is definitely not easy. It does take a lot of diligence. Like you really do. You have to pay attention. I find the days that I struggle the most are the days where I'm not really paying attention to what I'm doing during the day. It's when I get in trouble with not drinking enough water and stuff like that. And so, yeah, it definitely takes some focus. But at the same time, it's also completely doable. Like this is not an undoable thing. And even things that I thought, like when I was where Lindsay was, that I couldn't even imagine me continuing like long term. I was struggling with that. And I also couldn't picture how this would fit into my life long term. And even like my family was a little concerned about that. They're seeing you eat these bitty little portions and it's like, well, are you going to ever be able to go out to a restaurant again? And like, what's that going to be like? Are you just going to push your food around at the plate? Like, and no, the truth is that there are just adjustments that you make throughout the process. And eventually you learn how to incorporate those things back in so that you can enjoy things like going out to a restaurant, having a gathering, being at a gathering and not feeling like, oh, great, I got to bring all my own food. Like, you're not having that experience long term, which is something I know a lot of people are really, really concerned about. Like, is my life ever going to resemble what it was before?
Yeah.
And my answer to that is yes, but the ways that it doesn't resemble what it was before are good things. So focus on that. You'll be able to incorporate the good things, and the bad things you'll be able to steer clear from and mitigate.
Yeah. No, that's a huge point because a lot of people, food is such a uniter, right? It's so social, it's so cultural, it's so like family origin things. And it's a really big fear of people is that all of a sudden they're going to be almost excommunicated because they don't eat like they used to. And it's just different, and it's better. And it's going to take sometimes there's some hard conversations and you have to like set some expectations or some standards. But, it is, I mean, it's like, well, it's that or go back, or stay here. So, tell me a little bit like why you guys chose the ESG.
I'll start because I want to give appreciation to Kathy because I saw her Instagram. I had been researching VSG and I saw her Instagram and I was like, wow, that's actually really close to where I live. I live in the region and ESG. And I had actually already been on Eviva's page and I was like, ESG, I don't know what that is. Like, looking at other things. And I had a lower BMI, so I definitely wasn't going to be able to go insurance route. I was on like 35 at the borderline, and I luckily didn't have comorbidities yet. But I was getting to the point where it wasn't getting better, and I knew I had to do something because I would rather take charge now than when I have other complications that might make it harder for me to recover and do well. So saw her Instagram, then saw other people's and started doing research. And that's how I landed on ESG. And it's one of those things that have been like planted in your life multiple times, like seeing other people have different types of bariatric surgeries. And it's just seeing the last one a couple of months ago that someone I knew went to, or earlier in the year. And then when I had an incident, I had to go to the doctor. I was like, okay, I got to address this. I've been not addressing it for too long. And so I love that it was not an actual like laparoscopic surgery. I love that there was no incisions. Honestly, so did my husband because he doesn't love the idea of surgery for himself and it makes him very nervous. And so he's like, I will support whatever you want to do.
Spouses are very nervous about surgery.
Yeah, he was. Yeah. And so, and it was local. So there was just a lot of things that for me really hit, but also the like quicker recovery time. And it's just been really great. I've really appreciated seeing other people's stories because it's one you don't see as much because it's fewer people are doing it. And VSG is so very popular, but it was a great decision. I'm really happy with it. I keep forgetting that it happened. I mean, until I like take a drink, it's too big, and then I'm like, whoa, that was a bit much. Then I remember, but I feel great.
Yeah.
And I don't know if I would feel great if I had done something that was a little more invasive for me.
The back to exercise and activity is way faster. Yeah.
Yeah.
That's true. For sure. For most people, it's like considerably faster with ESG.
Yeah. I definitely chose ESG. Well, Eviva was not only did I feel like they had the best care package in the area, it was also like 10 minutes from my house. So it was like
it's so funny that we have two like local people because like we probably about 30 to 40% of our patients come from more than 3 hours away.
Definitely.
Yeah. I've been doing procedures on, I have an ESG patient in Japan, several in Asia, actually, Africa now. Like, yeah, it's crazy. It's all over.
So that was one of the reasons that there were other reasons too that I chose Eviva, but one of the other, as far as ESG goes, for me, not only was I also into the fact that I wasn't going to have incisions to maintain. Frankly, incisions kind of gross me out. So I was like, well, that would be good. The far lower complications for me, I think, was the real like sticking point, though. Like when I started to research incidents of things like dumping syndrome, and I learned that ESG, the rates of dumping syndrome are incredibly low.
Oh, and so, it's like barely, it's not really a thing.
Yeah. And because that was one of the things actually that had always given me pause with bariatric procedures or surgeries of any kind is I'm like, I can't imagine having to manage that. And I don't want to manage that. And so when I found out basically that there is a procedure that is similar to, not the same as VSG, but I wouldn't have to really be as concerned about something like dumping syndrome. That for me was big. I don't know, for anyone who's watching that doesn't know what that is, I don't know, Dr. VanderWel, do you want to explain what that is maybe?
Sure. Well, there's actually two types. There's early and late dumping syndrome. So early dumping syndrome usually happens pretty shortly after you take a meal. Usually it's a fairly simple carbohydrate rich meal. And all of a sudden it just like shoots through you and you like get diarrhea like pretty quickly right afterwards. And it is very unpleasant when it happens. Very unpleasant. Yeah. Usually it's, especially early dumping syndrome is usually like I knew I wasn't really supposed to do that. Yeah. Yeah. Like it's a good negative feedback circle there. Late dumping syndrome is a little different. And that's one where you have fluid shifts that happen in your body and insulin shifts that happen based on how much food you have. And later it moves through your gut really fast. And then it's like fluids moving back and forth. And then that's not necessarily diarrhea always. It's rarely necessarily that. It's just like, all of a sudden it's just like, whoa, like your blood pressure goes way down or your blood sugar chanks. And you're like, man, I do not feel good right now. And, it's always hard to parse out, well, are you having hypoglycemia? Is it actual like technical late dumping syndrome? But yeah, there's a lot more things that go into that, and they can be and that one's can be pretty rough. Yeah.
Yeah.
So as well. So there's ways to usually manage it when it happens. Some people have it more than others. Some procedures are more tuned to it than others. Like the gastric bypass is notorious for a dumping syndrome. It can still happen with ESG though. So when it does happen, it's very unpleasant. But the nice thing about the ESG is that the dumping syndrome stuff is very, very low. And then GERD too. Like GERD's probably the Achilles heel of the VSG. And GERD after ESG is like less, it's like 1%, like worsening GERD. So which is fast. Like I when I get up and I talk at meetings, all over, and people and all these, especially when I'm talking to surgeons, they're always like, well, what about the heartburn? What about the GERD? And I was like, I don't know. I don't have an explanation for it. It's the weirdest thing I've ever seen. I literally don't have an explanation. But I think the ESG sort of shortens the stomach, and maybe for some reason, and I've seen hernias, like, so when you have a hiatal hernia, you have a little bit of stomach that's up in your chest. And I've seen doing ESG on someone with a small hiatal hernia, it reduces the stomach down, and it doesn't fix the diaphragm part. Like that doesn't get any tighter, but it shrinks the stomach into the abdomen. I've had patients with heartburn and a hiatal hernia, and their hiatal hernia is like almost gone. It's like gone at the end of the procedure, and their heartburn is vastly improved, if not gone also. And I don't know what's going on here. So, but it seems what's cool is that like there's been some really good work ahead of us that I feel like it's been safe to do, and it's can totally corroborate that it has been. So, sorry, that got a little off track with the heartburn case. Yeah, go ahead, keep going.
I also haven't had heartburn in, well, I don't know when did I have? I mean, well, I couldn't say that I did. I couldn't say I didn't have it post procedure because I was also on all the heartburn medications, but once I got off of them, I was actually really a little concerned that, because I was, before ESG, I had heartburn every day. I was taking Tums all the time. And like, but it wasn't like so intense that I was ever going to be like, I need to see a doctor about this. It was just like, it's there. But what I realized after I got off of all of the heartburn medications after the procedure, once the stomach is healed, I was blown away by the fact that I had none. I have not had any since.
I don't know either. It's the weirdest thing. It's the weirdest thing.
Yeah. So in fact, when I I think I got it like one time, and I was so surprised. I was like, what is wrong? And then I was like, it's a little heartburn. And then I thought about what I had eaten, and I'm like, that actually makes a little sense. So yeah. But yeah, so for me, it was complications. That's why ESG was the way to go.
Yeah. No, ESG is, overwhelmingly been a very safe procedure. Knock on wood, our practice does pretty well with our laparoscopic surgeries too. Like our complication rate for that beats the national average by a long ways. But even then, just like you've seen the device, like it's not very big. It's honestly hard to really hurt something in there. It's doable. Anything's doable, right? You're gonna get hurt getting out of the bed. But it's I mean, if you just got to respect it, you take care of it, you really do it. Take a lot of care when you're doing it. Overwhelming. Yeah, it's such a cool procedure. So, what was your process to get to surgery? Can I tell people like what was it like when you like, hey, okay, you decided in your mind, all right, I'm gonna submit that form online, and we're gonna do this, and then what was it like from there, if you can remember?
Lindsay, you want to start?
Sure. Yeah. So, I was really happy because it was a pretty fast process. And once I decide that I want to do something, I'm like, can I do it tomorrow, please? Like, I like a decision and I got to go. So After I put in the form and I talked, I had already just recently done blood work with my doctor. So your team looked at my blood work to make sure I got all the things hit, discussed, my medical background. I met with a nutritionist to kind of give me the lay of the land. And she asked a lot of background questions about how I eat, what I've done in the past, how much coffee do I like to drink, just a lot of things. And then was pretty open about what it would look like after the procedure. Like, you can't drink coffee for 6 weeks or have caffeine, or, and like, this is the size of food that you're going to eat, and how that make you feel. So that was a pretty great one. And I was like, yep, great, love it, let's do it. And I met with Dr. VanderWel, and then, got all the information about all the diet, both the pre-op liver reduction diet. Is that what you're calling it?
Yeah.
And then in all the background. And then for me, like, I just poured over the materials. I like wrote it in a book. Like, I have this notebook that's just
Nice.
for ESG, and I have like the days written on it, and I have like at the top how many grams of protein I'm supposed to hit, and what my cup size, and how much fluid I'm supposed to have. So I kind of poured over all that material and just really focused. I had like another nutritionist and meeting with you, Dr. VanderWel, a little before 2 weeks, to make sure that I was set for what I needed to do prior with the LRD, and just kind of tried to follow it to a T and really focus on it. And I think that really helped. I felt really prepared, other than being really thirsty on the morning of. Like, I felt good. And, a nurse called me right before to make sure I understood all my medications were. And everyone was there for me. I had some like pharmacy issues, and your team was like on there for me, like emailing, telling me what to do. And yeah, it was pretty simple and pretty fast. I think early May might have been when I put in the materials, and then with timing and stuff, I had it done beginning of July.
Yeah, nice.
Yeah. My process leading up, like the actual process from the time I engaged like Eviva to surgery date, was a little longer. I remember, like, Dr. VanderWel, you and I had a discussion about, I was going to Lummi Island, actually, at the end of August. Yeah, I was going at the end of August. And we had a discussion of, well, do you want to be like, sort of like, we could do it kind of like, I think I engaged at the end of May of 2022. Sort of had my first real discussions kind of beginning of June. And then it was like, there was a conversation about, well, we could probably do this as early as like end of July, early August, probably, like, but, as long as there was nothing that really came up in the blood work. But we decided to push it back, actually, because it was like, well, let's just sort of get through August. And so it was like that process. It was great that there was some flexibility there too. Like, I wasn't just sitting there waiting for like a surgery date. Like, we could really like actively decide, when is this going to work best. So that part, and honestly, like the process leading up, identical as far as the actual process, identical to Lindsay, truthfully. It's very specific. It's very clear. And same thing with after. It's very specific, very clear, but very easy to follow. So you kind of know exactly what you need to do, when it needs to happen, how it's going to happen. And that's really important, because otherwise I've observed other people, they don't really know what to do. Like, it's really shocking that I've interacted with other people that have had ESG at other clinics, and they don't know what to do. And it's really like, and then they leading up to and after, it's like, it's actually kind of scary, because they're sort of going, I don't know what to do. I don't know how to navigate this. And it's like, well, it's really unfortunate. So leading up to that, though, like, my process for deciding to get ESG at all was, I've been obese from childhood. So this wasn't baby weight. This wasn't anything like that. And so I've been thinking about this and considering it for years, but I always felt like it was just too extreme. And then I had a series of things happen in 2022 that felt also equally as extreme, but it was a result of me being as obese as I was. Because I'm short. I started at my BMI was 49.5. And so it was quite high. And so there was just a bunch of things that had happened. And what I realized was a few things just sort of clicked in my head that, obesity is a medical issue and it should be dealt with as a medical issue. Yeah. And so, you can do things behaviorally all you want, diet and exercise, all you want, all day long, but it's a medical issue. So you really need to approach it from that angle. And
until those flips get switched, switches get flipped, it's such a different disease. It's such a different disease. It's so weird. And I wish we understood it better, but I can't communicate that enough to people that, you're just fighting your body. When you get, especially if you struggle with obesity since your childhood, but even if you just get obese, like that fat takes on and becomes its own organ system. It starts requiring its own needs from your body. There's just weird stuff that happen that make it so challenging. It's not like you just say, okay, I'm just going to just do this and then I can do it. It's like your body's fighting you every single day, every single meal your body's fighting you. Yeah, sorry, go on.
That was basically it. Like realizing that it really was a medical issue that I could not do on my own, despite years. I can't tell you how many times I've joined Weight Watchers, like, how many diets I've done, and I have lost weight in the past. I have, but it was never sustainable. And it always involved something that I was going to have to stop doing like if it was with medication, well, then I'd have to stop the medication. Then I'm at great risk of it coming back. So something that was really more permanent and that I could sustain on my own, that I could have that tool that I needed to actually address this, and also do this with a doctor, do this with a medical team that's dedicated to that success explicitly.
Yeah, and has really a lot of experience doing it. Yeah. No, that does make a big difference. And interestingly, to just a little behind the scenes thing, the ESG has actually helped us up our game a lot, actually, in our follow-up. And at the very beginning of this, this may be more surgically technical than anyone cares about, but like I really approach, in hernia surgery as a surgeon, you are always looking to how do you get this space closed and this tissue healed together as strong as possible. And there's always things that you're managing there. And I just think of like when I'm doing the ESG, very different than the other procedures. I think about the stomach now as a hernia. And I'm like, how do I get this hernia fixed and have it be as strong and as durable as I possibly can so that it works in the ways I want? That's just from the mechanical side. And one of the things I was thinking about long term, and I was like, you know what, volumetric force, like force from the inside is actually and I see people, we do revisions in our practice. It's interesting. There's a lot of bariatric practices that don't do a lot of revisions. So we do a decent amount. So we get people from all over. And I started going through my brain of all these stories when I see people come back after they've gained weight after any weight loss procedure, like sleeves, bypasses, BPD-DSs, like all sorts of stuff. Like everyone can gain weight back. And a very common thread between most of them is that they push the limits of that portion size, and your stomach is a stretchy organ. And we've seen it in surgery. If you have something that some organ like your stomach or your colon that you're kind of pushing its limits, it stretches to a huge shape. Remember like that little Japanese guy, what was it? Yakumo? No, it was Kobayashi. Kobayashi, the speed eater guy.
Oh, yeah.
From a number of years ago, they could do that shake thing, like this. And like he would train by stretching out his stomach. He would drink like a gallon of water or something and pound tons of hot dogs, right? Just in training, just to stretch it out. And so your stomach can stretch out. And I thought, this is how, this is kind of a problem that happens after bariatric surgery. And we need to actually give ourselves, and even a lot of places that I hear, a lot of surgeons I hear, they actually don't have a volumetric guideline in their head. And I thought, I think that's actually, we're doing a big disservice to our patients because we're telling them, just listen to your body. You've struggled with obesity your whole life. You should not listen to your body. Your body's the last thing you should listen to. Like, if your body feels like it's going too much, then yeah, definitely you should style it down. But we should give people guidelines.
You told me, remember we had a conversation. This was really shortly after the procedure. I was mistaking gas. I was mistaking that for hunger. And you actually said to me, you're like, your stomach's a liar. And I was like, that's probably true.
Yeah.
I could
It
totally
is.
imagine that feeling, Kathy, because it does. The gas is weird. It's a very different experience.
I've said that to a lot of people that like very shortly after their procedure, they'll be like, oh, I feel like the rumbly tummy feeling, you know. And I always ask them, I'm like, does it feel like your tummy's growling? And they're like, yeah, no, it's that. And they're like, I'm hungry. And I'm like, nope, probably not. If you and I always tell people, especially shortly after, think about how, and this is what you said to me, Dr. VanderWel, like, think about when it was you last ate. If it's within a certain period of time, physically, there's very little possibility that you actually are hungry because your stomach still has food in it. So it's still working on it. So, you know, and of course that's different if you're on full liquids and stuff like that, or clear liquids particularly. But like, so there is some difference there. But once you're on to like food, once you're on to like regular food, like just think about when was the last time you ate, how much did you eat, and sort of work backwards, like sort of calculate backwards. And then you can assess, are you actually hungry? Or are you thinking that you're hungry and you're just going to continue to put food in your stomach and then do that stretching process? You're just going to start the stretching process and you might not even realize you're doing it. That's why like they always recommend like at Eviva, they're really big into like, don't graze, don't, you know, snack. And so it's like, you know, what a lot of us have that mentality of like, oh, like, you know, just 8 little tiny meals a day. Well, that's a little bit of grazing. Like, so you got to sort of think about, okay, well, how much am I taking in if I'm just sort of grazing all day? And that's, you know, and so I always tell people like, actually measure your food, actually look like, not just weight, physically measure your food volume wise, because that's how much is going into your body. Like, think of your stomach like a bag, like a pouch. Think of it not like like I always tell people, like, instead of using the word sleeve, like maybe use the word pouch, because it physically makes you think, it makes you think visually of a bag. And I find that some people then can sort of like they can visualize it a little better and realize like, oh, I'm being told to eat this. This might be too much.
Yeah. I liked your post that one time about the spinach, and you're like, 8 ounces of spinach. No, don't do it. Don't do it.
Like a sea of spinach. Yeah, no, so that comes from I do interact with online. I interact with a lot of ESG patients, and one of the things that I hear regularly are people that are told, they just said per meal, no more than 8 ounces, something like that. It's like these very, very, very broad definitions of how much they should be eating, and then so they talk about like, oh, well, then I had 5 ounces of steak or something, and you're like, and so I'm like, okay, let's do a visual. Like, what is like, and so like one of them was spinach. Of course, I did popcorn, which popcorn is very often not eaten after bariatric procedures, but popcorn is a great example because it's light and it takes up space. And so like 8 ounces of popcorn, it's a tremendous amount of popcorn. Like no one would ever eat that in a sitting.
Yeah.
Like when pre-surgery, pre-procedure.
I could not eat 8 ounces of almonds right now. Like there's just no way I could do 8 ounces. I'd be like, oh God, I could not fit another almond in my face right now.
To use like the scale, like the only reason I use my scale is to accurately like determine how much protein is in like the chicken or whatever. And I have like 3 different right now quarter cups.
That's the best way to do it.
And so I have like, if I'm putting a little something in it, and then I'll put another thing, and then I'll, you know, weigh it and use the tare, but use both of them and then dump them into a little ramekin.
Yep.
But yeah, so invest in multiple measuring devices.
Absolutely. Yes. Absolutely. And just shove that food into that cup and, you know, like, just put it in the cup. Like it's even, because like one of the things, so like I use the Baritastic tracking app, and I will say like, there are quite a few things in most of these apps that they don't have it in the app measured by volume. And so like you do sometimes need to do both. You need to go like, okay, well now here's my cup. I've put the amount in my cup, and now I'm going to plonk it on a scale. I'm going to see, well, how much is that, so that I can track it properly and assess the protein, the calories, you know, and everything that I need to get put into the app so that I can make sure that I'm on track. That's the other thing, like track your stuff.
Yep.
Even
Track.
like when like just track it.
That's a good segue into like kind of what's your routine like, and what do you recommend? What do you recommend to people from a routine standpoint?
I'll start. So my recommendation is, well, like we've been talking about, measure everything. It's not like it feels like a big pain in the butt at first, but you kind of honestly, it just becomes part of your routine. It really only takes 5 seconds to just pop something on a scale and note the number, like, or put something in a cup and go, this is what I'm eating. Like, it really only takes a moment. My routine is, so I'm pretty awful at starting my water early enough in the day. You do have to drink a lot of water. And so it's 64 ounces minimum per day. And so you will notice I've been taking sips. I am late enough that I'm allowed to use a straw.
We've actually updated that since we've liberalized our straw policy.
Yeah. Good. Yeah.
I get to try it 3 weeks.
Yeah. I think I was longer because I was scared to try a straw. But you know, I like my routine is I get my first thing in the morning. I get my water. I do a protein coffee, and then I just I still really do think about the timing of when I'm eating, and so usually around like 10. So I have like the protein in the morning my protein coffee has a protein shake in it. So I've got that first thing, sort of sets me up. And then I start my workday. I have my water, my coffee, and I just sort of, and then I just, for me, I work out usually 4 to 5 days a week, typically. So my routine is usually I try to get out and do a run like midday, put on sunblock and the hat. And, but yeah, so I find for me, that's the key is my key for my routine is consistency.
Yeah.
So it's just being consistent. When I get inconsistent, then I struggle to stay on a routine. So, yeah, it's get that water early, measure everything that I'm going to take in, and go about my day. And just keep my food as far as what I'm choosing to eat. Keep it protein first. I'm not super particular about what I eat per se. I just always make sure that I'm doing the protein first and then I'm tracking it so that I can see where I'm falling throughout the day.
Cool. Thank you for sharing. Lindsay, what about you? I know you're kind of early, but like what's sort of the routine and like what is your sort of plan for the next phase too?
Yeah, so for me, I have gotten actually in quite a good routine. So I start off the morning and I drink my protein shake. I can't have coffee yet, but I'm so excited for when I get to have that again with a straw in like 4 more weeks. And that usually I usually do either an 11 or a 14 ounce, and that can take me like this morning it was about an hour and a half because I had a bigger one. So that takes me quite a while, and I just sip on that while I'm getting ready. And then I've really thought about like how my life works right now. And so like I get my kid off to camp, and then when I come home, it's been about 2 to 3 hours. Then I have like a little snack, and it's a snack, but really it's just spacing out meals.
It's just a meal. Yeah.
It's just a meal. So I've been having like an egg or something kind of breakfasty because I like that. And then at lunch, I look at where my protein's at, and I think, am I going to try and get something in that's got protein in it, or like a meat, or am I just going to add a little protein powder to something else? Because I'm just trying out some different stuff with the purees. And I mentioned actually Dr. VanderWel. I feel like in this phase, the protein drinks, like the shakes, are what's holding me together, right? Because we can get like 20 to 30 in one of them. So that's like most of my protein to get to my goal. And then it's like when you're doing baby-led weaning, if you do that where like nutrition comes from the milk and the bottle or the formula, whatever you're using, and then all the foods that the babies are trying is just for like fun to learn. So it's like I had some sweet potato yesterday with some pureed chicken and barbecue sauce, like just to try something out. And so just it's an opportunity to try something different. And so usually I have like 3 little puree meals and 2 shakes, and I kind of space it out depending on what I'm doing through the day, and my water. And I have a little divided vitamin keeper.
Oh,
So
Nice.
like I have my calcium when I have my protein shake, so that I'm keeping kind of calcium with calcium, and I have my multivitamins usually with my purees because they're usually not dairy based, and just keeping all that together. And for
Well,
the
you got
next
that dialed
phase,
in nice then. Yeah.
yeah, I'm trying. I'm like, I want to be able to give blood again. I want to be able to like be on top of stuff so that all my nutrients are together.
yeah.
Cool.
That's a big goal of mine. And then for the next phase, like I know I'm excited to have salmon again. I'm looking into kind of like what those things are, but I still have a week left, so I'm just trying to like stay
Not trying to
focused
get too far ahead of
on
yourself.
what I've
Yeah.
got to do. But one thing I do with my water is I have a big like 64-ounce stainless steel container, and I just fill that up all the way first thing in the morning.
Yep.
And then I just pour from that. Any water that I drink is poured from that. So then I know at the end of the day
Yeah.
Yep.
that I'm there, so I can have different things. So
That's what I do too. Yeah, I do. I don't have a 64. I have a 32 ounce, so I know I have to get through 2 of those. But I use that like my pitcher. Like it's like my pitcher that I pour from all day, and I pour into this, which is 24 ounces, and yeah, that's how I manage that. It for me, it really does take focus though. Like I know some people that are really good at like winging it and stuff like that. I was never good at that, and so like for me, like when I started the first time I had to go really like back to the office, like that took like planning. And so sometimes, I mean, I will say that, like sometimes, especially when you're a little earlier in your process, like it's going to take some planning. You're really not going to just be able to just fly by the seat of your pants. Like you're going to need to plan it out. You're going to need to think about, okay, if I'm going to take this, this, and this is going to get me to here with my protein for the day. Then I know later in the day I'll do this. Like it just does take some forethought, and that takes a little practice too. I think for most people, it probably takes quite a bit of practice. So
that's a huge thing I recommend
skills.
too. Yeah. That first 3 months, I tell this to people all the time. That first 3 months, if you really work hard on your plan, on your structure, on measuring your portion sizes and tracking them, and you really get into a habit with that, it really sets you up for the next year. Like that first 3 months, if you really get in a good rhythm there, you're set up for the next year. I mean, it's going to be, there's a lot of other ups and downs that's going to come in that year, but if you have those skills, you're really, really on a great foundation. And if you really do well in that first year, you're set up for the next 3. Like, and that could because, and emphasizing those skills of measuring your portion sizes and tracking your food, you just want to really be comfortable with that in that first year, because eventually, like some people still measure and track everything, but a lot of people are like, hey, I'm in a groove, like I'm in a rhythm here. And so it becomes a lot more intuitive, but at some point, all of us are going to get off track, right? We're going to wake up one morning, we're like, I got to get this thing back on track. So if you had a time in your life where you're like, yeah, okay, I was crushing it with my measuring and tracking, I can get back to that. Okay, okay, yeah, let's do it. Pull those skills out of your back pocket and let's go. But if you haven't invested in those skills already, and now you're struggling again, it's really hard to like dig yourself out of that hole if you don't have the skills already. So yeah, I can't emphasize enough too, like having that good routine in those first 3 months and having a clear plan and measuring your portion sizes and tracking your food is just so helpful. It's such a good investment in your future. So
yeah,
it's not the end of the world if you're not there. Like you can always start working on this stuff. We can always get better from where we're at. But man, it never gets easier than it is in that first 3 months.
Yeah.
And I really like the Berrytastic app.
Yeah, me too.
For me, because it doesn't feel like any of the other tracking things that I'd ever used at different points. So it feels very different, and I feel like it really highlights protein.
Yep.
It's easy to track your water, and I have reminders for all of my supplements, all my vitamins in there. So like I get a little notification to remind me to take stuff. So it's nice. I think it's great.
Yeah, agreed.
What's been the hardest part?
What's been the hardest? So for me, some of the hardest parts were also some of the most valuable parts. I think for me, the hardest part was actually the really, really difficult realization that, and this was in the first couple of months because that compulsion to eat was gone.
Yeah.
One of the hardest parts was the very was the realization that I genuinely had a problematic relationship with food.
Yeah.
You know, probably to the point, like I remember having a very early conversation with you about, you know, sort of like what were my like eating habits, and I said like, well, I know it's sit down and kill a bag of cookies, and you know, or you know, I'm not killing a big thing of potato chips, and that's true. What I realized though during that was, and this is what it was a really hard realization, because it was also realizing like I'm in danger of going back to that, because when you sort of have this addictive relationship with food, that doesn't end. That doesn't just magically disappear. That's always there. So you really have to be conscious of it, and you're going to address it forever. And that's just a fact. And so that was a little bit of that was a hard realization for me. But I remember one point thinking, it was right around, because mine was mid-September. And so I was navigating early in this process at Halloween. And Halloween for me was, I love Halloween, and Halloween for me was always, we did the thing where, you know, you get the bag that goes to the, you know, the kids that are coming to the door, but you get the good candy for you to eat, right? and that's the candy that you stash in the cupboard. And I realized that while I wasn't like classically binging on stuff like that, like I wasn't going and eating the whole bag. What I would do is I would go, like, over the course of an evening, I'd go and take, like, you know, the little 2 or 3 inch long Snickers, you know, right?
Yeah.
I'd go and take like 1 or 2, eat that. Go and take two or three more, eat that. 2 or 3 more. So over the course of an evening, I was eating probably, when I really thought about it, and I was like, wow, that's a lot of food, that I really didn't realize what I was doing. Like I never had that conscious realization. And that was really hard for me. And I think that's something that I can't stress enough for people. When you're going into this journey, really seriously consider engaging with mental health as well. Engage with a therapist, because it is very likely that you could uncover things that need to be addressed. And that's part of the process too. So that for me, I think, was the hardest part of the process, but I think singularly the most valuable part too.
Yeah. Well, yeah, I know it's early so far, but
I'm still in the, like, you know, just kind of rolling along, doing what I'm told kind of phase. But I did realize that whole conversation about gas and hunger made me realize there were so many things when I wasn't feeling good, like my stomach hurts or I don't feel good, that I would eat thinking it would solve it. And I'm sitting there and my, you know, your stomach hurts. You're not feeling great. You just had a procedure done. You're laying around. And I was like, my mind wanted to eat, but I'm like, no, that is not a thing you can do. You can't even put like real food in your mouth for another 9 days.
Yeah.
But I was like, why is my mind telling me that? And I was thinking about all the times that I would be like, oh, I don't feel great. Let me eat this and see if it makes me feel better. Like not even emotional pain, because I've done a lot of work with that. Like I get that part, but it was like the physical feeling. I didn't
it's
realize
like this,
that I was using
this
food.
compulsion. Yeah.
Yeah.
It's a very interesting, it's compulsion and almost in conditioning too.
Yeah.
Like your body's conditioned, you know, like almost like you train a dog. Like your body is trained, your mind is trained. It's like it's Pavlovian almost. Yeah.
Yeah, like the whatever I received from eating that food in my mind made that physical pain go away, which obviously it wouldn't. And so realizing that was something I was like, oh, this is new for me. But I completely agree with Kathy, doing the work and spending time thinking about stuff. And I'm realizing, like, when I'm not eating all the time, there's a lot of free time on my hands. And I don't really know what to do. I'm like, normally I would like grab a snack or eat a popsicle. Like I'm not doing those things. So I'm like doing the dishes and going on a walk, which is actually really great.
Cool. What would you guys, so I think this is sort of my last question, but what would you tell someone interested in doing the ESG or doing something? What would you tell people that are struggling out there?
I would tell someone who is struggling that I would suggest, no matter who you engage with a clinic, talk with a clinic. If you, like I said, if you do engage with a clinic, though, make sure choose one like Eviva that offers like a really comprehensive package, Like, don't.
This isn't one thing you want to go budget on. Yeah.
Exactly.
It's like LASIK. I'm going to get budget LASIK. Yeah.
Exactly. I don't know about that. Yeah, no, like that's really important. But also, if you're like, I think that so many people spend so much time on the fence about this. Just have a conversation, because I think that is, for me, that was like, after I started talking to Eviva, I felt heard, first of all. And that was really important. You're told sort of I was told basically my whole life, like, this is pretty much your fault, right? Like, you being obese, this is all you're doing. And as I've just disclosed, there were certainly my behaviors that did not help, but like, just the realization that, like, there is so much about this that is legitimately not in my control. So talk with a clinic, talk with someone, a bariatric professional, like, engage with a bariatric nutritionist. Like, that's also critical. Like, not a regular nutritionist, like, unfortunately, like, no, actually someone who knows how to manage bariatrics. And so
most nutritionists would be horrified by the calorie numbers we give people. Horrified.
Yeah. That's what I say. Just have a conversation. I think you'll be happy you did. And you'll get so much freedom and control of basically your life, honestly. So yeah, it's a gift to yourself, and you're worth it.
Yeah.
I would say I really love the analogy of this being like a tool. So if, for me, like, the things that you'd used before haven't been working and you don't have all the tools that you need, and this is one that you can add, that can help you get kind of past this. And thinking about obesity as a disease really is what changed my outlook on some of this stuff, and that there was something that I could do to help and not just something that I was. Really changed kind of how I approached it. And I love that it's a tool. And with that being said, it needs to be used alongside other things like your behavior change, like mental health, like environmental change. So if you're ready to do that, and you're ready to stop just kind of like trying on your own, or following plans that you read about and online, and actually working with professionals, it's a really great option. I'm really glad I did it.
I think that's a big point too. Like, when you're ready, when you're ready to make the changes and take it seriously, you're gonna crush it. But if you're like not really there, and you're not totally committed to the process, or giving up some things that really need to be worked on, I always tell people, just wait till you're there. And it's gonna be so much better when you're there. You're gonna really hit this out of the park. But if you're not there yet, you're just gonna lose the opportunity to use that tool the best it can. So, but with that being said, I'm shocked all the time. Like, there's some people that show up and I'm like, this isn't gonna go that great. This is gonna be a pain in the butt. And they crush it. And they're just like, something flips their switch in there, and then like other things. And then all of a sudden it's like, I'm like, who is this person? Like, is this the same person? But it's, I mean, you can't be judgmental as a bariatric surgeon, period, right? When you first start this. And I have really learned to be judgmental, to like not even try to assume I know how people's journeys are going to go, because I've been every bariatric surgeon says they've just been so wrong sometimes. So yeah, but cool. Well, ladies, anything else? I mean, I think you guys have been fantastic. I know we've taken up a lot of your time, and I really thank you for being a part of it. So yeah, well, anyone who's out there, I hope this was helpful, and we look forward to doing more podcasts at Eviva. I'm going to try, my goal for the ESG ones is probably every few weeks. I would like to do some sort of ESG sort of related topic. And if there's questions out there, Gally, if you're like collecting questions or like the common follow-up stuff, I'd love to hit on that stuff. And we can, I'm just going to be trying to bring in as many patients as possible, and just to talk about their experience, and also the questions that people have. What they want to hear from is you guys, and I can give like my big picture analysis, but like the trenches is really where I think that means a lot to people. So I think this is super cool that you guys are here, and really appreciate you guys, being vulnerable and talking with everybody. So.
Well, thank you.
Thank you.
And Lindsay,
Yeah.
it was good to meet you.
Well, it's nice to meet you too, Kathy.
We've interacted some on Instagram,
Yes.
but I've never spoken to her.
Yeah. Hashtag real life.
Yeah, exactly.
Very cool. Well, thank you again, ladies. And thanks everyone for tuning in, and have a great day.
Thank you. Bye.
Thanks.